Hello everyone, welcome to part 2 of how to prepare for a better pregnancy and birth even before you conceive. I'm so excited to do this episode. I'm running really late to my midwifery weekend, but it's totally fine. I am trying to kind of figure out my thoughts about this part 2. And what I've realized it really comes down to is having informed choice, having the ability to clearly pick options that align and throw away options that don't. Take my experience, for example. My mom had a gynecologist/OB, and then that automatically became my gynecologist/OB, and that is who I had my first baby with. And I had no even idea that you could look around for different OBs or even have a midwife. So part 1, we really focused on what birth is, how to learn about birth, and how to get a better idea of what you may be interested in for your experience. Now we're going to talk about the logistics of figuring out who you want at your birth and where you want to have your baby. And again, it's totally cool if you're not even pregnant yet. I think this conversation needs to become more mainstream. When we purchase a TV, we imagine what it would look like in our living room. We imagine the channels that we're going to be watching on it. Will we get the service that we want if we buy this TV? Will it be worth the money? Will it work better than the other option? And will it provide the service that we are looking for it to provide? And this is the way that we need to approach our birth experiences. People bring their energy, they bring their experiences into our births, and we kind of need to know what we're setting ourselves up for. We put so much decision into buying something for our home, we almost forget that we have that right as well while we're pregnant. First, we're going to talk about birth location, and this is a loaded discussion, so I'm just briefly going to go into the different places to birth, but let's be honest, you can birth anywhere. There are people that birth in the woods, there are people that birth in the bathroom, there are people that birth at the hospital. There are different places to have your baby, and it's not ever supposed to look one way for anybody. This is a choice, and so the different locations really depend on what you want out of your experience. If you decide to stay in the hospital, like 98% of the women in the United States, then you may find that you want to do research around hospital protocol. But the truth of the matter is that there is temptation there, and also fear could also live there. Many people that work in the hospital don't see many physiologic births, which is natural birth. And so they think that they need to do things in order for mom to have her baby, and that's just not the case. So know what you're getting into if you do decide to have a hospital birth. It can be completely in your hands, and that is a little bit more tough to do in the medical system, but it doesn't mean that it's impossible, right? Nothing is impossible. So do your research and know that there are benefits and risks to any place that you birth. The other options are a birth center. There are different kinds of birth centers. Some are attached to hospitals, and some are what they call freestanding, which is not attached to a hospital. And in these birth centers, there is no access to epidurals and medications like what you would have in the hospital. So it really comes down to like what their policies are. Midwifery care really just brings more wholesome prenatal support and love, and this can better birth outcomes. It's definitely something to consider if you're not sure if you'd like to birth at home or at the hospital and you'd like something that maybe is in the middle. The third option is home birth, and home birth can be attended by a midwife that is in your state. It depends, either licensed or a traditional midwife. And all midwives practice differently, so it's still important to ask questions, and we'll get into that a little bit now. But home birth means that you can probably birth your baby wherever you want to, and you have the option to really take control of your experience and be more undisturbed than you would be in the hospital. There's people always in and out of hospital rooms and things like that. So it's really a more private and intimate experience where you do have the ability to make more choices for yourself There is no access to pain medication. It is more of an intimate experience for you and your baby, for bonding, for that undisturbed physiologic birth and golden hour. The last option I'm going to suggest is free birthing. And this is something that's becoming a little bit more popular. It's when you birth at home without a midwife. And so again, there is that risk and benefit, but some women feel like this is the best option for them. Of course, my point in all of this is to just do your research. And if you're curious about something, research the pros and the cons, and keep in mind the prenatal care. Prenatal care is seriously so valuable. It really makes such a difference when we can have somebody in our corner to openly talk with, openly feel love and support from, get information from if we need it. It is seriously priceless to have somebody who loves you caring for you in your pregnancy. This makes me automatically think of midwifery care and how we've birthed for thousands and thousands and thousands of years was with the love and support of a midwife. And it really does last through postpartum, and it changes the way that we walk as women, like when we have that support. So I highly recommend learning about midwifery care, learning about your options. There are amazing midwives that also serve in the hospital, that work alongside OBs. It's possible, right, to create this experience, this hybrid experience, if you will, of both the medical and the wise woman way. Like, there is a way to bring that together, and there is no one way that's better overall. What is better for you? What is the best way for you? And I guess that's really the conversation that I'm trying to bring to the table. You don't have to do it one way just because that's what you hear about in your community. You can truly create the experience that you want. Once you get clear on your location and where you want to have your baby, the next step would be to interview some of the local healthcare professionals, midwives, doulas, and learn about what that would be like. And a great way to do this, I'm sure Google has tons of questions, but really getting clear on the questions that you want to ask them. I believe Indie Birth has a podcast episode on these questions. I don't know if I'm making that up or not, but if I do find it, if that is real, I'll put it down below. And also, I offer a pregnancy clarity call for pregnant mamas, or if you're just planning and you haven't conceived yet, that's totally okay too. But I help moms get clear along with their partners or families on what kind of experience they want by answering questions and helping create lists of questions and things like that. So please feel free to reach out to me if that's something that interests you. But really bringing questions in that are intricate and are maybe even simply answered. Like, what do you do for a mom that hits 40 weeks of pregnancy? Do you do anything at all? Do you induce? What is your protocol? What is your cesarean rate? Or what was your cesarean rate last year? Or do you support women who want to birth squatting? Like, these are the kinds of questions based off of the research that you've already done in learning about birth that would help you paint a picture of what it would be like under this person's care. And of course, along with those questions, bring your intuition, because anybody can answer a question the way that you want to hear it if they're paying attention to you and what you want. So it's really important to bring your intuition and really think about the way that this person makes you feel, how you feel about their answers, if you feel like they're being genuine, and that will also help in making that decision. So get that list of questions to ask who you're interviewing. And as far as doulas, it's the same thing. If you're not sure if you'd like a doula or not, go on a few interviews, see how you feel with doulas, learn about what they do. If you're looking to have a hospital birth, how do they feel about hospitals? Are they comfortable with advocating? Would they prefer supporting home births? Learn about that culture in your area. It's all really beneficial, and learning about it and meeting more people and talking about it more will help you get an idea of what this could mean for your experience. And again, Facebook is a great place to find out about your local doulas and a great place to learn about people's experiences, and learn about the birth culture in your area, because these are things that like aren't common conversation for the most part. We usually only hear one type, which is, oh, I had an epidural and it went great, or I had an epidural and it was terrible. Like, you don't really hear about the detail, and so find it and really utilize it to your advantage. And lastly is resources. Get together a list of prenatal specialists in your area, those that are chiropractors, acupuncturists, postpartum doulas, and different services for prenatal women. If there is a meeting, like some type of pregnancy group or La Leche League, or something that could help create community. In these resources and groups, you are gaining tools. You're gaining more access to a world that is not commonly talked about until you're pregnant. These are the types of communities and groups, both on social media and in person, that help women find the support and care that they need. And so don't shy away from community building and local resources in your pregnancy. Like, lean towards that. Put yourself out there and create the experience that you want to create, because only you are capable of doing that. And I think now it is starting to become more of a topic, like resources and different locations for birth and the different kinds of support that is out there. But we really need to play an active role in creating our experience. So my biggest point in part 2 is to do your research, and you will find your answers. Don't settle. You will find what you're looking for. So I hope that this was eye-opening for some, if you didn't know about some of the things that I talked about. And if you have any specific questions, feel free to reach out to me. But thank you so much for being here, and I will see you guys in the next episode. Bye-bye.